Hey, I'm Shane from Shane's Law. One of the questions I get asked is, what are some signs that I'm not getting better or that I'm getting worse, and when do I need emergency medical attention, okay? Now, here's the thing about emergency medical attention. It's for an emergency, okay? So it's usually right after the accident or if something just goes way wrong, okay? We see this most often, like I said, right after an accident or before somebody's treatment is stabilized, okay? So in that, first 7 to 10 days, sometimes we see people have to go back to the ER, especially if their treatment is not consistent, they haven't been set up, the pain may get to where it's intolerable, or you're worried something seriously is going on, so you gotta go back to the ER. Another time this pops up a lot is when we have women that are pregnant and they've been involved in a collision, and I would say for the next 30 to 60 days, if you've got anything crazy going on, they need to go back to the ER, make sure nothing's wrong with that baby, okay? Now, afterwards, I would say anytime it's right after a procedure, you get an injection or an epidural or you have a surgery or something like that, and you just feel things are off, go to the ER if you need to, okay? If you can't get in touch with the doctor. But certainly if you have anything unusual, like a lot of bleeding from that scene or numbness and tingling is always a stressful thing, and it's always something you definitely need to talk to the doctor about. Almost every single doctor's office has on-call, so if you've got your regular doctor, you've got an after-hours emergency, say you had that procedure, say you had that surgery, call the after-hours. They'll call you and check on you, and they should be able to tell you whether it's something serious and you need to go to the ER or not. What you don't need to do is just grin and bear it, okay? If you've got pain or something unusual going on, crazy bleeding or crazy cramping, or we see it in muscle weakness and nausea, definitely talk to your doctor, and if you can't reach them, do that after-hours service so you know whether or not you need to go to the emergency room. One thing we see with people who've had procedures or maybe trying a new medication or something just different in the doctor's office is we see allergic reactions, okay? If you've got those, certainly in the very beginning, if it's not that bad, call the doctor, see if you can take a couple Benadryl, okay? I can't give you any medical advice. That's why I say call the doctor if you're worried about that. Itching, scratching, welts at the scene, anything that seems to be spreading from where an injection or shot took place outwards, definitely get in touch with that doctor, okay? If you're having trouble breathing, I'm gonna say go right to the emergency room, but definitely if you think you're having an allergic reaction to the medicine or procedure, call the doctor. If you're taking a new medication and over 2 or 3 or 4 days, you're getting worse and worse and worse, call the doctor. You could be having an allergic reaction, okay? That's something we definitely don't want to happen, and your doctor doesn't want to happen, so talk to your doctor, all right? If things feel weird, go get it checked out, okay? What we don't want is any of our clients sitting at home wondering whether they need to go to the doctor or not. If you're stressed about it, let's go to the doctor or at least use that on-call service, okay? Charlotte, if you're in pain, call Shane, 980-999-9999. And like and subscribe for more personal injury tips. Click that bell for new notifications. I'm Shane.
In pain, so I call Shane, 980-999-9999. In pain, call Shane.